So today we brought together a number of our NHS colleagues, we brought together NHS Improvement, the HSN and our industry colleagues to talk about digital transformation in outpatient services. And the reason that's really important is because the NHS has to have a digital revolution in all our services if we're going to start to have a sustainable model for the future.
We're here to share the success that Barnsley Hospital has had working with healthcare communications in launching the patient portal, which was just over 12 months ago.
We built the ability for patients to interact with the trust digitally, so the patients will receive an SMS message with a secure link and a PIN. They put in their date of birth and the PIN, which accesses their digital letter.
The postal service is slow, is quite impersonal, and so we've moved away from the old-fashioned post approach to a digital approach which enables us to have that much quicker and more timely communication.
The Academic Health Science Network introduced Jill and I because they had worked with both of us separately. I work in the nutrition and dietetic department. They had met AirLogic. We had a couple of projects going on at the same time. We started working with AirLogic because we knew that their Forms for Health tool could help us to improve patient care for our irritable bowel syndrome patients because they were still on a very paper-heavy and quite slow process. So we wanted to be able to send a form to patients where they could summarise their IBS symptoms and then send it back to a clinician. We've been using that instead of doing it inside of appointments, and we've found that patients like it more, saving clinicians time, and it's providing better quality care for IBS patients.
The system looks to capture data digitally, and we've been working with a range of organisations around Leeds to put these forms into place.
Some places are progressing it more rapidly than others, so I think we can learn from each other, we can share ideas, and bringing people together today is that opportunity to hear what's happening. We've got a lot of people in the room today, so we'll have a lot of ideas and a lot of opportunity to go back to our own organisations and think about how we can do things better.
I think one of the biggest things that has come out of all of the networking sessions that I've been at is the need for clinical engagement. We'd really like a repository of information and knowledge sharing that we could go to.
I've met lots of people who have got lots of really good ideas. I've heard some of the companies demonstrate what they can bring to the picture to make our patients have an utterly great experience in outpatients.
We've hopefully across the morning shown people real examples of where places local to them have made some fundamental changes in the way that they deliver services through digital implementation and reduce costs, increase patient experience levels, and also raise patient safety as well. So people should go away thinking, not only this is exciting, but it's completely possible, and I know where to go next to get some help to do it in my own local hospital.